Dr. Ashish Jha is the Dean of the School of Public Health at Brown University, and he joins us this morning. Dr. Jha, good to see you, sir. Thanks for your time.
Good morning. Thanks for having me on.
Dr. Jha, let's start with this new mutation. As I understand it, it's not terribly unusual for there to be mutations like this when it comes to viruses like this. But this particular mutation, reportedly 50% more contagious. Does that mean it's deadlier? And what does that mean for the two approved vaccines?
Yeah, so great questions. These viruses do tend to mutate a lot. That's pretty normal. The more infections there are in any place, the more opportunities for mutations. It does look like, by all the evidence, that this is more contagious. That means if you're exposed to it, you're more likely to be infected than maybe with some of the other strains. No evidence that it's any deadlier. If you get infected, no evidence so far that it's going to be more likely to be harmful. And I am not, at least in the short run, I'm not worried about it having any effect on the vaccine. The vaccine should be able to cover this, but we're going to have to track this closely to make sure that that doesn't change over time.
As you know, the governor of New York wants everyone traveling from the United Kingdom to get tested before they arrive here in New York State. You've got Dr. Anthony Fauci saying that a travel ban would be too far. Nonetheless, though, dozens of countries have banned travel from the United Kingdom because of this new mutation of the virus. What do you say, Dr. Jha? Should there be a travel ban? Should we be testing everyone that comes in from the United Kingdom?
Yeah, so, what we know about travel bans is that they tend to slow down the spread from a specific country. So I think if we did one from the UK, it would slow it down. I doubt it would keep it out of this country. I would not be surprised if we already have a few of those cases already in this country. That's the nature of global pandemics. So I'm not opposed to a travel ban. I like the idea of testing everybody before they get on a plane and come to the U.S. But I don't think ultimately we will be able to keep this strain out of the U.S.
We now have two approved vaccines, Dr. Jha, and perhaps unsurprisingly, there seems to be a bit of controversy over who should be next up in line to get the vaccine. There's been some talk now, the Republican governor of Florida saying the idea of a 22-year-old fast food worker getting the vaccine before a 74-year-old grandparent doesn't make a whole lot of sense. What do you say, Dr. Jha? How should we be deciding who gets the vaccine next?
Yeah, so there are two sets of goals with a vaccine, right? One is certainly to protect the most vulnerable, that's the elderly, but also to slow the spread. And that's why we put essential workers on the front lines, because they're much more likely to get infected and much more likely to spread the disease. I think what CDC did was recommend that we should pick from both groups. But states have flexibility. If Governor DeSantis feels like the 74-year-old should come first, I think he and the state have the ability to do that. We do want to be putting essential workers in that next batch as well, though, because they are more likely to be exposed. They are more likely to spread it, and we want to protect them as well.
Really quickly, Dr. Jha, we're seeing records set in cases, hospitalizations, deaths. A number of public experts have said what we're seeing is a direct result of Thanksgiving travel. What would you tell the millions of people that are traveling for the Christmas holiday?
Yeah, I would say I totally get why you're doing it. We are not traveling this year, and I'm recommending that people stay home. We're so close to having widespread vaccine availability. This is not the time you want to get family members sick. This is the time to hunker down. Things are pretty bad right now. 4 to 6 weeks, I really do think things will start turning around. Have good holidays, but keep them safe and keep them small.
All right, Dr. Ashish Jha, enjoy your holiday, sir. Thanks as always.
Thank you.